Hi, my name's Kat O'Neill. I work at San Antonio Regional Hospital, and I'm the manager of Medical Surgical Department. Growing up and going through school, high school, I was kind of deciding what I wanted to be when I grew up. Through high school, found a love in math, and I decided that I wanted to be a high school math teacher. So I applied to Cal State San Bernardino. I got in there and started my journey as a high school math teacher. I took all the prereqs, and then once I started here at San Antonio Hospital in the surgery department, totally afraid of blood. The person that was training me right at the beginning when I started working here said, "Hey, do you want to go in on a case?" And I was so scared because I didn't want to see blood, but I couldn't say no because I felt like, okay, this is my new job, so I need to stick with it. So I said, sure. And I was like, okay, I got this, not too bad. Then we proceeded to enter into the OR suite, and the surgeon at the time went on to explain everything that he was doing. It was a controlled environment. I wasn't afraid. It was like so neat to me. And then as I continued to work in surgery, I realized that I needed to take a turn. A high school math teacher was no longer in the works for me. So then I went on to the nursing career path. I applied at Cal State San Bernardino to their nursing department, and I didn't get in. It's very hard to get into nursing school, but that didn't stop me. So I continued to look at other options. At the time, going to school out of state was kind of popular because it's still kind of hard to get into nursing school. So that's what I did. I went to Idaho. I went to BYU. I got into their nursing program, and they had an accelerated program, which is only 15 months. I graduated and then came back to my roots as a nurse. Every day here at San Antonio is different. I oversee 4 nursing units. 2 of those include oncology, which is for our cancer patients, and also ortho. And then the 2 others are medical surgical floors. Typically, I come in, I round on all of my units, make sure that my nurses have everything that they need, that my staff have what they need. I help with patients, any patient care. If someone looks like they're struggling, drowning, I jump in, and that's kind of what I love, is just to get my hands dirty a little bit, which is always nice. For current high school students, I recommend asking a lot of questions. Go to some mentors in the field that you're interested in. At the time, when I was in high school, I was interested in a high school math teacher, so I would talk to all my teachers and educators. As I moved more into the nursing career path, I started talking to nurses, my family, and found some answers to my questions. I also recommend you to volunteer in the line of work that you're interested in. If it's nursing, whatever line that is, volunteer, get yourself out there, and make sure that that is the career that you think it is. You know, sometimes people get into a line of work and they thought it was completely different what they had pictured. So I say I really recommend you volunteering your time and putting some work in. I encourage you to not stop. Continue on what you think you're going to do that you're going to love. Don't worry about the money. Don't worry about the time it takes you and how long it takes you to get there. You will get there, and keep going.